Welcome back. In this video, we'll talk about the resuscitation fluid amount in burn patients. Before we start, you have to remember these 3 points. We always use ringer lactate. The urine output is the best measurement for fluid resuscitation. So before starting, insert a Foley catheter. And age is the single most important factor when it comes to prognosis. It is the most accurate factor when determining the prognosis of burn patients. Second after age is the other comorbidities, such as cancer, HIV, or end-stage renal disease. And of course, you have to be familiar with the body surface area, which is how we calculate the amount of burn. And keep in mind, we only calculate or measure the second and third degrees, not the first degree. Let's go through it very quickly. Each upper limb is 9%. Each lower limb is 18%. The head and neck together are 9%. And the torso is 18% anteriorly and 18% posteriorly. The most famous equation is the Parkland Formula, which goes as follows. 4 multiplied by the total body surface area of the burn multiplied by the patient's weight in kilos. Once you multiply these factors, you'll get a number, and this is how much you need to give the patient of ringer lactate in milliliters. You give half of this amount in the first 8 hours, and the other half in the next 16 hours, and that's a total of 24 hours. So for example, let's say that we have a patient who weighs 70 kilos, and he has second-degree burns in the anterior aspect of the entire right lower limb and full circumferential burn of the entire right upper limb. Calculate the fluid needed to be given to this patient in the first 8 hours. And here is the answer. Next is the revised Baux Score. Some people call it Baux Score as well. And unlike Parkland's formula, we use this one to indicate the prognosis. It basically gives you a number of how likely the patient is to survive. The higher the number, the worse. And it goes as follows. Age plus the body surface area plus 17 only if there is inhalation injury. So for example, let's say that we have a 30-year-old patient who presented with burns involving the entire posterior torso, and there were signs of burned nostril hairs and soot in his lungs. Calculate the revised Baux score. And here is the answer. And finally, the American Burn Association. They use the same formula as Parkland's, although they have decreased the number 4 into 2. So it goes as follows. 2 multiplied by the body surface area multiplied by the patient's weight in kilos. And they have decreased this number to avoid fluid overload. Nevertheless, they agree that we use 4 instead of 2 in cases of electrical burn, and we use 3 in cases of infants. And that's all I have. Thank you guys so much for watching, and don't forget to subscribe.